All right, everybody. Thank you so much for being here for another amazing interview. This one, I think this one's really going to help a lot of you. This one is about how stress, worry, and fear can show up as urgency and prolapse, pelvic health issues that I know a lot of you are dealing with. And so if you are watching this right now, you're going to love this. I have Dr. Sara Smith, a colleague of mine who is with me today. She's someone that I have not met in person, but I feel like we've been like friends forever. And she is a physical therapist, a doctor of physical therapy. She's a yoga instructor. She's a women's health and nutrition coach. She actually went through the same program that I did. And she has a program where she does mind, body, spirit healing mentorships. And she focuses a lot on core blocks. And I'm going to have her tell you about this because it's not just necessarily the physical core, like core fitness, like your abs and your back. We're not really talking about necessarily that core. There may be some other things that we need to talk about as well related to the core. So I'm going to let Sara kind of take it away from here as far as a little more about her background. And then I want to get right into our topic and kind of really hone in on why the pelvic bowl and the pelvic floor is a place that can harbor stress and worry and how that can contribute to prolapse and urgency and all of these things. So Sara, welcome.
Thank you. I feel like we've been best friends forever. So this is such a treat for me to be with you. Okay, so a little bit more about my background. Yeah, we were sharing a little bit before we started recording that, I knew from a very young age the term mind, body, spirit. Probably, I think I was going around like a little fairy saying that, even when I was like 7 and 8 and 9 and 10 years old. And so physical therapy, I kept finding myself wanting to really do hands-on work and really being able to spend time with people. And as I chose to go more into the women's health field, and I do say pelvic floor physical therapy just because some men come to me as well. But as I was beginning to do the pelvic floor work, we learned so much in our training about the impact of trauma and abuse and stress. Michelle Lyons, as an example, she was, one of the first people that I attended a course with, and, the impact that stress can have in the body, she really left a lasting impression on me with that. But because of kind of my own background and interest in spirituality, and my mother was a counselor and a licensed clinical social worker, so I was forever, getting kind of the mental with the physical. And so I started seeing when I was working with my clients, my patients, that they had physical symptoms going on, and it like prolapse and urge incontinence and leaking and back pain and hip pain. But there also was this component of feeling out of control. They would start sharing their personal stories, and maybe they didn't have any support around them, or maybe they were in a challenging work situation, or they had some relationship issues going on at home or with a mother or father, or, there was more to their story, as we know, because we're dealing with whole people and not just pelvises and backs. And so it really, between my yoga training and really getting into the philosophy of that and the lifestyle of that, and with deciding finally to go into coaching, because I knew that I needed some more tools to really sit with people in the space that they could share, but also take action and transform. Because I think for a lot of us, and myself included, we know exactly what to do, or we know where to go to find the answers, but are we doing it?
Yes. I mean, no, we're not doing
right. Exactly. Yeah, no, sometimes not doing it. It's not always the simplest. And so I found really that when you start combining, and so much research is showing about this now, but when you start combining our patterns and our thoughts and our beliefs and our perceptions and what's going on with the mind, when you really connect that with what's going on in the body, you can see a lot of symbolism and connection and meaning that can really enhance someone's physical results, and then also enhance how they're showing up and enjoying their day-to-day life, so that they go from feeling kind of complacent or like, yeah, things don't really feel great in my life, but I shouldn't complain. Everything's pretty good, to, wow, I didn't even know that I could live this wide open and this joyful and this grounded. Like it was a shift.
Oh, I think we all want to make that leap into that beautiful space, don't we?
Yeah.
And so I know that one of the things we talked about that people may have felt when they're in that not so great space, there's some things that are contributing to that probably. One of the things we've talked about and reflected on is postural issues and kind of a lifetime of holding patterns and emotional patterns. Can you speak more to that?
Yes. So, I can't say that I could necessarily go back and pull the research articles, but what I have seen with, now having children is that most babies, as they're coming into the world, their nervous systems are, they're aligned and they're working really well. And of course, there are outliers to that, to children who are coming in differently for various reasons. But in general, right, we come into the world and everything's kind of working in the nervous system. We have the stress response nervous system, and then we have that relaxation response nervous system, and they're jiving really well. If you watch a baby's belly go up and down, it's beautiful rising. The diaphragm is flowing, right? It's cooperating as it's supposed to. And what I have a theory of this, and what I've seen over the years is that for different people, it happens at different times. Some children, it happens much younger in life because of a home situation or, something that's happened. For other people, it's a motor vehicle accident. For other people, it's having a baby. But it's a shift. It's a stressor, okay, or a trauma, depending on the word that we want to use. But it's a stressor, and we kind of start not really using the diaphragm very much, and we kind of start shutting more into our accessory breathing muscles. Mm-hmm. And when we do that, posturally, you're going to see the difference. Mm-hmm. So if you think of somebody emotionally, like if I'm not having a good day, right? Or if I'm feeling like, I've got some money issues, I've got some pain, I've got this or that, what happens? The shoulders go in, the heart gets protected, right? The abdominal muscles, a lot of times the hip flexors get tight. And all of that is sympathetically, so in our nervous system, activated, because fight or flight, if we're going to fight, we're going to use certain muscles, mm-hmm. right, to kind of recoil ourselves. And so these are the muscles that show up for people that are typically tense. But the brain is constantly activating it. Muscles just respond mm-hmm. to what they're told.
Mm-hmm. Yeah. Well, and I was just going to say, we've talked so much on my channel about posture and the importance of, yes. Because, the focus of today's call is, of course, how this can all affect prolapse and urgency. And if your posture is in that kind of like shallow breathing and hunchy posture, even if it's not like, it's not going to look like that. Yeah. I'm exaggerating it, of course.
Exactly.
A little shortened in the front, then that's going to press down on your pelvic organs. And it's going to also press down on your bladder. So you're going to have all those sensations. Is that the idea then of what you're saying with this? Like physically, is that the emotions trigger yes. the physical response? Yeah. Okay. Yeah.
Absolutely. Yeah. That, and not to be vulgar, but, you know, I always tell people, I'm like, where is the big, giant, gaping hole? Like, where's the pressure going to escape? Right? And people really quickly get like oh yeah, you know, yes, if everything pressure wise, because internally we are a pressure graded system. And so, yes, if the posture's going and it's typically following what the mind is doing, because the brain is our computer. It's like the, you know, the commander in chief of the army. And then the muscles are then responding to that. The fascia is responding to that. The organs are responding to that. And so how we are feeling tends to show up. And when it happens more chronically, then like for example, with prolapse or with urgency, and they really go hand in hand. I'll explain that in a second. But, you know, that's when we find kind of these chronic postural patterns, right? Like prolapse usually doesn't just happen overnight, right? It happens because it's like a repetitive strain, you know, and a repetitive downward pressure, and then a weakness. But you know what's interesting, and Brianne, I'd be interested to hear what you have to say about this. A lot of times the pelvic floor muscles, when you evaluate them, they're not necessarily just weak with prolapse. Mm-hmm. They're actually kind of tense.
Yeah. Yeah. You don't have to have, if your muscles are tense, that doesn't mean they're strong, is a big thing. Right. But I know a lot of women who come to my channel, and when I was clinically practicing and evaluating women in person, yes, that was a big issue. And I think it's happening. I feel like I'm hearing about it more and more and more too. This condition of hyperactivity actually being the problem versus hypoactivity or you know, weakness in that way. Yes, huge issue.
Yeah.
It's one of the reasons.
And we will.
I was going to say real quick, one of the first things I do in my LIFT program, my pelvic organ support program, is actually train people to release and relax the muscles, because before you strengthen, you have to learn how to let go. And I think so often the women with prolapse or urgency are trying to keep everything in and up, you know, they're trying to, and so their muscles may actually be tense to help with that. But unfortunately, it's not helping in the long run.
Yeah. And I love, because I mean, I've followed you for years now, and I love the way that you do your relaxation training, because it is so vital. I mean, I'm so glad that people are, you know, continuing to flock to your program, because that is vital. If that step is missed, then everything is missed. And again, it loops back, in my opinion, to the brain, because the pelvic muscles and the organs, as well as the entire abdominal cavity, they are very autonomically based. Like the nerves have a lot of input that is coming from the autonomic nervous system, the sympathetic and the parasympathetic. So again, depending on who you're being and how you're thinking. And interestingly enough, 80% of our thoughts are habitually negative. That's what research shows.
Yeah, that's so sad and so true.
Isn't that wild? Yeah, and so true. Yeah, and nobody really generationally has taught, like if you look at, I'm going to go real world view for a second, but if you look back historically at all of our cultures around the world, they've been riddled with just survival, right? And so no wonder the brain is hardwired this way. And the brain takes longer than, like, you know, our rational self. Like, yes, we're coming up with all these ways to, like, you know, be positive and but the primitive brain takes longer to heal. Yeah. And it needs the relaxation. It needs to learn the relaxation. And so generationally, nobody has taught us how to relax. Nobody has really taught us how to heal ourselves generationally and from the inside out. And so when something isn't right up here, and it tends to be chronic, right? Like a time issue, who doesn't have those, or a money issue, or, you know, a healthy food issue, or weight, whatever it is, when that happens up here, because the nervous connection in the pelvis is so sympathetically driven and parasympathetically driven, it's going to respond. Yeah. And so if what's happening up above is tense, that's what you're going to get in your jaw and your neck. And that's also what you're going to get in your pelvis.
Mm-hmm. Yep. One of my favorite books of all time, back when I was first starting this field, was called A Headache in the Pelvis. And it's true. It's like that area up here that can get tense and create headaches can also get tense in the pelvic girdle as well, that area down there. So it's like a headache in your pelvis. I love that analogy. It's like the two areas of our body that can get tense is up here and down there. So yeah, I love this. And so I want to talk a little bit more. You had mentioned something earlier about the connection between prolapse and urgency. Can you touch on that really quickly?
Yeah. So with urgency, and again, in a more symbolic or connected view, right? Because we think of urgency, and I like to use funny analogies. We think of urgency as push the old lady out of the way syndrome. Okay. It's like you have to urgently get to the bathroom. You don't care who's there. You're just like, move. Okay. And so that's what we consider urge incontinence. But when you take a world view and you're looking a little bit at the bigger person, at the whole person, you'll find that people have kind of these living patterns where they're also living urgently. They're living by the to-do list. They feel like they have to overdo. They're taking responsibility for a lot of people around them. They're mother archetypes, they're healers, they're fixers, right? Like there's somebody who you can rely on to get a problem and go like this and solve it. Like they are, and I know I can relate to that. And so many of us can, like we're juggling lots of things. Yep. And so urgency a lot of times doesn't just show up in the pelvis, it's showing up in your life in different areas. Like not feeling like you have enough time to clean the house, not feeling like you have enough time to devote to girlfriends, this thing that comes in. And what happens is that when we feel that way and we're sensing that throughout the day, we then feel unsupported, which then a lot of times is very common with prolapse, right? Prolapse is a lack of support, right? Like the simple definition is like you've got the pelvic bowl and no longer is everything supported. Pressure is building. So think of that connected wise, where else in your life has pressure been building and you feel like you just can't control it?
Yeah.
That's how it's showing up. And so what I find is when I work coaching wise in these mentorships with women to see, oh, this is how it's been showing up in my life. And you begin to not just like dwell on it. It's not, let's rehash the past. It's actually a very fun, freeing process where you can realign your nervous system and realign your brain, your heart, your soul, your core, so that when you get this straight, I have literally, I can't even make this up. People are just stronger. Prolapse begins to heal. Urgency begins to, resolve itself. And while it doesn't mean like, oh, the prolapse, the bladder's never, sliding down slightly, or the rectum's never sliding down slightly. It doesn't necessarily mean that, but it means that suddenly this rise of empowerment and rise of wholeness comes back.
And this is what you mean by your core, right? You're talking about the core, meaning not just the abs and your pelvic floor, but you're also meaning the core ability to handle your emotions and manage your stress and all of that. Is that correct?
It absolutely is. Yeah. And even like living from the heart, and living from a place where we feel whole. So one of the things, and it used to really, it kind of perplexed me, but I do definitely understand it. When I was just doing pelvic floor physical therapy, you would have women that would come in and they would be talking about their prolapse, and they would be like, oh, that is so gross. Like there's something just, like this is so nasty. And same thing with incontinence, right? Or urgency. It's absolutely embarrassing. It is mortifying in a lot of ways. It's frustrating. You feel so out of control, until you have a guide like hiring you or, working with someone. And so but it was perplexing to me. I was like, gosh, this is like a life-giving force. This is what like all of us come from at the end of the day.
Yeah.
And so we're denying parts of ourselves. You see it with chronic pain, and you see it especially when there's prolapse or when there's something embarrassing going on with the pelvic floor. We tend to dissociate the mind and the body. It's like, ugh, that's gross. Let's cut that out. Let's get that out of there. Let's forget that it's there, but really, as and you teach, when you learn how to relax, you learn what the pelvis needs. You learn to talk to your body, right? And listen and hear it and go, oh yeah, that's what you need. Then you become whole. And it doesn't mean like, let's get all kumbaya with our bladders or uteruses, but I mean, it totally can. It can. But it just means that all of a sudden your body parts and you are beginning to mesh and work together. And so that's what I mean by the core too, is it's like, we're not just like dividing ourselves into all these little parts. We're coming together into our true God-given form that is, that we all need, love, and want to be whole. And live
girl, you said that so beautifully, and I'm with you. I'm so into tuning into the entire body, because it, one thing I notice is people so often ask me what's right for them, as far as, is this workout prolapse safe? Is this, and the thing is, what I try to teach with my work is how to tune into your body, so you cannot be dissociated from that part of your body. So you can feel it emotionally, so you can feel the tension there, so you can feel the pressure there, so you can physically just feel the muscles there and know how they work. Because that's the only way. You're the only one who can tell if an exercise is right for you and your pelvic floor needs. So I just think that is so key. This kind of getting over that, or not getting over it, but just being brave and tuning into this part of the body, despite the disgust factor and despite the gross factor, because it's not, but I know we all think that it is. I can't tell you, almost every woman who came to see me in clinic would say, I can't even believe I'm telling you this, but ... or this is so gross. Oh my gosh, I can't even believe this, but ... And, so I understand. And I've had my own pelvic floor issues as well. And I know, most women have. And so I think just owning it and just saying, hey, this is real life and it's okay, is so, so key.
Being empowered.
Yeah.
Being empowered to know that it doesn't have to stay that way. Mm-hmm. It doesn't have to stay that way. And it's such a personal decision, because I had someone through Instagram recently say, well, the only way to take care of a prolapse is surgery. And no, right? Now it's a very personal preference, right? Like some people are very firm in what they know needs to work for them. But we also know that the placebo effect is real. And so if you know it's going to work for you, if you believe in the person that's helping you, if you believe in, I am going to get better, and you really do believe that, like on a scale of 0 to 10, like you're very, very on point with, I'm ready, like I'm fully ready. My body's ready. My mind's ready. I'm ready. Then it happens, and it doesn't have to stay just, the way of disappointment and disgust and frustration, and really controlling, your life, because the pelvis is really like a headache. Like, it can control your life if unmanaged, if unbridled.
Yeah, it absolutely can. It can. And I mean, it's not to say there are some people, and we're not saying that surgery is a terrible option. We're not saying that at all. So for some people, it is the best option. But I think Sarah's saying here that don't let someone tell you that. Do not let someone tell you that prolapse is, that the only option for prolapse, especially if you just have a minor prolapse. Don't let someone tell you that the only option is surgery. It's really important to explore and to see, to look into alternatives. So I want to leave people with kind of an actionable tip. And I want to say what I used to tell some of my clients. And Sarah, maybe you can build upon this. And so, so for urgency, for urinary urgency, I used to always tell people that it's really important because you're feeling that urgency to get to the bathroom, and it stresses you out, right? So you're like, oh my God, I've got to get to the bathroom. And so you start running to the bathroom when you're at the height of urgency. And that's not a good time to go, because your bladder is like feeling like it's super full, even if it's not. It feels like it is. And you're not in a good place to be able to control your bladder anyway if you're stressed and if you're at that height of urgency. So I always taught people to learn how to ride the wave and to try to not rush to the bathroom, to try to walk to the bathroom slowly and calmly, and ultimately to do something to make that wave of urgency subside. And then when it subsides, because it does, the urgency kind of comes in a wave, like that. And so ultimately calmly walk to the bathroom when you're at the low part of that wave, when you're not at the height. And one way I used to teach people to do that is to actually do 3 to 4, however many little Kegel exercises. And that's only for a person who can do Kegels effectively, which is not everyone. But you do a little squeeze and then release, and then a little squeeze and then release, and another one. And that will usually make the urgency wave kind of subside. And so then you can slowly and calmly walk to the bathroom. But I was thinking as we were talking that I love that trick still. I think it's a great trick, but it really, when I was teaching it to patients, it was really only focused on the physical aspect of the body. And I mean, it was tying in the emotional a little bit. But I was thinking just now how I wonder if that could really be carried over into all areas of our life, not just for urgency for when we have to go pee, but urgency in general. Like, for me, I feel urgency. I tend to feel urgency all day long with my work tasks and with this, that, and the other thing. And I've got to do all this stuff. And maybe instead of like rushing and working at my hardest when I'm at the height of that feeling of urgency, maybe it's a good idea to slow down and breathe and get calm, and then approach my work, and then approach my family, that kind of thing. Does that sound, are you with me?
I'm totally with you. Yeah. And, and so, I'm gonna back up into the urgency talk just for a second, because one of the, again, I love funny analogies. And, when we have the brain and we have the bladder or the bowel, right, with urgency, and then we have the pelvic muscles, you have 3 players, okay? 3 teammates. And if you're in a bar fight, who's going to win? Is it going to be just the little pelvic muscles against the brain and the bladder or the bowel? Because that's what's typically happening, right? Like, the brain is freaking out, like, I've got to go, because your bladder or your bowel is like, I'm going to explode on you, right? So that's 2 players that are really stressed out. It really doesn't matter if you have like a 5 out of 5 really strong pelvic muscles. Who wins the bar fight? 2 against 1.
Yeah.
Right?
Yeah. So true.
Always.
Yeah.
So true. And so, yes, definitely. It's like getting I call it finding your Zen moment, like really being aware. And I think an actionable step, which is, it's like the easiest, hardest thing you'll ever do, is taking that breath and saying, okay, hold on. I'm aware, like it's almost like kind of pulling outside of yourself for a second and kind of like looking from a bird's eye view from behind and being like, oh, I'm doing it again. I'm going there. I'm going into that frantic place. And when you see that, then you can have a choice. Only then can you have a choice, right? Because most of the time we don't even know we're doing that. We're just like, blah, 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 you know, and then we're like snapping at people around us and we're less productive.
Yeah.
And so for me, it's all about let's get to the point where we have a bird's eye view. And the way that I do that is I do it in a really, I think it's a fun, for some people it's visual, for some people it's a word. But so like, can we play for a second?
Yeah, I love this.
Okay. So when you are in a state where like you're urgently doing your business tasks and you're running around, what's a name that you could, like, what would you call that part of you that's doing that? Do you have a name that comes up, or like, it could be funny. It doesn't have to be anything that makes sense.
Oh, I don't know. Like Crazy Brie is all I thought of. Crazy Brie. Like just Crazy Brie. Ah.
Yeah. 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 And mine is the taskmaster. Like, I have this visual pulls up of me with this like giant scrolling to-do list that I like flip out like this. And I'm just like, you over here, like, but I'm doing it to myself. Right. And so when you identify like Crazy Brie or taskmaster or, you know, wild dare, you know, devil, whatever it is, doesn't matter. Okay. Then you all of a sudden, because it's funny and it kind of takes it out of the realm of reality.
Yeah.
You can all of a sudden begin seeing it for what it is. So I'll be interested to know, like, if you go around the rest of today and if you notice that you might catch yourself now being in Crazy Brie mode, right? And then you can go, oh, hold on. Do I want to do that? Because we always have a choice. We always have a choice. And so the choice can be, you know what? Like, I want to be in Crazy Brie mode right now because that's the best I can do.
Yeah.
Or, wow, Crazy Brie mode is actually, it feels in my body. It feels like it's tensing my shoulders. It's causing me a headache. I feel like my butt is like so clenched that I don't know what to do. That isn't helping me. I'm not productive, nor am I getting anything done. And oh yeah, I just yelled at that person over there. And then you can go, let's try the Zen moment. Let's see if we can feel, right? Some of these muscles that are so tense in Crazy Brie moment, feel them relax. And so I would ask you, if I was working with you, it's like, when you're in Crazy Brie mode, where do you feel the tension coming up? Where is it in your body?
Well, in my body, I definitely notice it in my butt cheeks, like you just said. That's a big one for pelvic floor issues. And I feel it in my chest though, like just this tightness through my, like I can't breathe. Like it's just really tight. I'm not breathing, for one thing. I'm not breathing deeply. Yeah. My ribs not expanding. It's just like tight.
Yeah. And so when you connect with that feeling, when you're like, oh, I know what that feels like, but it doesn't feel good, right? Like it's a kind of a tension, a tourniquet. And again, think of it in the physical realm. When we're tight up above, there's pressure down below, right? Yeah. Yeah. And then on an emotional realm, nobody likes to feel squeezed. Yeah. It doesn't feel good, to be that sort of tension. And so then when you feel it in your body, you connect it with something silly, right? Like Crazy Brie mode, then you have a choice. Hold on. Let me let this area of the chest relax. Let me let my glute muscles relax. Okay. Now let me try this again.
That is I love how you brought in the choice, because sometimes you might just want to be like, no, I actually do. I want to get all this done. I'm in that. And don't beat yourself up. Sometimes we just have our rough times, but I love that choice factor. I love that, because most of the time, I think most of us will be like, oh yeah, it's okay. Like, let's take that Zen moment and make a better choice. I love reframing it that way.
Oh, I know.
Mhm.
And the other thing that comes up as you say that is I love like the primitive brain, the part of you that really like kind of sabotages things and doesn't really want to change and is scared. Like it knows, it likes predictability. Like the primitive brain doesn't just want to flip and switch, you know? And so if you're used to living urgently or feeling unsupported or feeling like you're doing it all or that there isn't enough time, you know, we can't just magically expect ourselves to be peaceful and, you know, present and happy. And, you know, I've got so much expansive time, like overnight. Like the primitive brain would kind of be freaked out by that. And it won't go too well. But so instead, what I love to do is I love to run experiments. And when you run an experiment, you're not committing hardcore to it. You're simply dabbling and getting to feel in your body for yourself. Is doing it this new way, is it helpful?
Yeah.
And then you get to gather data, right? And you get to go, oh my gosh, that was so helpful. Like, wow, I actually got more stuff done. My kids were more calm. You know, we had a beautiful dinner together or a nice time at the park. Wow, like that actually worked. Or you get to go, you know, that didn't work in that moment. I might try it again, but that, you know, that didn't work for me in that particular moment. So you always, when you run things as experiments and you're gathering data, then again, you're empowering yourself, just like you were talking about, Brie. You get to empower yourself to feel what's right for you in your body and in your life.
Mm. Oh, I
Mm.
love this. This is so good. I hope everyone just listens to this and takes this information home. I want to wrap it up with just kind of a summary of what we talked about. So, living urgently can definitely affect our urgency of our bladder. They can correlate. Living with a lack of or too much pressure and not enough support, that's prolapse, but it also can contribute to posture like this, a shallow breathing, things that can actually contribute to prolapse physically. And then also, yeah, I mean, that's really kind of what we talked about mainly. Was there anything else just to kind of wrap this up? I mean, I love the tip at the end, my kind of riding the wave and how that can apply to life, but how you tied in everything else with that too, as far as just like the identifying the taskmaster or the crazy Brie and then making a choice, which
Yeah.
is really riding the wave, as I had spoken to it earlier. So yeah, I mean, is there anything else you want to leave us with to kind of wrap this up?
No, I hope that people have fun with this because it's, you know, it's such a neat way to see things and it doesn't have to be daunting. You know, when we make something fun and enjoyable and lighthearted, then that's really when true change can begin to unfold. And so I'm excited to see how this works for people. And, you know, please get in touch with me if there's any questions or, you know, I'm excited to hear. So
I
the
love it.
response.
Well, and actually, I was gonna leave with that exact thing, which is how can people get in touch with you?
Yeah, so I am kind of everywhere for the most part. You can find me on YouTube. My YouTube channel is nothing like your YouTube channel. Mostly Facebook and Instagram, but it's Sara, Sara Smith Wellness. So Sara Smith Wellness on Facebook and Instagram. And then my website is sarasmithwellness.com. And I do have a complimentary, like I love gifts. I love receiving gifts. I love giving gifts. And so I have a 30-minute session with me that anybody is welcome to take advantage of. And you can book that on my website at sarasmithwellness.com. And I love.
Hey friends, unfortunately my interview with Sara cut off right there. The internet went down and things just kind of stopped. So I just want to share with you that she really is offering these complimentary sessions with her. So if you want to learn more about her work and maybe just talk more with Sara, please do check out her website. All of the information is in the video notes. And thank you so much for watching this really wonderful, I think, interview. I just love Sara's calming, grounded, and yet so, I don't know, just fun and sweet personality. I hope you loved it too, and I hope this gave you lots of information. So Until next time, I hope you'll remember to subscribe to my channel if you like what you see here. And as always, eat clean, move every day, and you will shine brighter. Thank you again for watching, and thanks again to Sara for being on the show. We'll see you next time. Bye.